All right, so imagine this. You're a brand new nursing student, fresh out of the classroom, and right onto your first clinical rotation.
Oh, right into the thick of it.
Exactly. You've got all this book knowledge about patient care, cracked open a medical textbook or two, but then
Bam! Intentional rounding.
there it is. Have you ever actually stopped to think about what that experience is like from their perspective, though? These students who are suddenly expected to just do the thing.
It's a perspective that often gets overlooked, for sure. We tend to focus so much on those patient outcomes, the end result, that we forget about the learning curve, the journey those future nurses are actually on.
And that's exactly what we're diving into today. We've got this super interesting study from the 2022 Journal of Advanced Nursing, and it really digs deep into the world of these pre-registration nursing students. So they're still working towards becoming fully registered nurses, and their experiences specifically with intentional rounding.
Which is a pretty key area because for a lot of these students, it's their very first exposure to a practice that's considered absolutely fundamental to good patient care.
It's been like trial by fire, isn't it?
Okay.
So before we go any further, let's define it. For anyone who might not be familiar, what exactly is intentional rounding?
Okay, so intentional rounding, often shortened to just IR, it's all about being proactive, getting out ahead of any potential issues. So instead of nurses just reacting to calls or emergencies as they pop up, they're proactively checking in on every single patient at these set intervals.
So it's about staying one step ahead of any problems, anticipating those needs, rather than just, like you said, reacting to them.
Exactly. And it's something that's expected of every single nurse, no matter how experienced they are. And yeah, that includes these students who are just starting out on their clinical rotations.
Which brings us to this idea of a theory-practice gap, right? That disconnect we often hear about.
Oh, absolutely. And this study really highlighted that. They found a real disconnect between what nursing schools are teaching about IR, all that theory, and what students were actually experiencing in their clinical practice. Think of it like, I don't know, being taught how to bake a cake from a cookbook, right? But then you get thrown into a busy restaurant kitchen with just that book knowledge and told to just go for it.
It's real-world experience versus textbook knowledge. They're just not always the same thing.
And what the study found was that a lot of these students, they said they were actually learning more about all those little nuances of IR from their workplace experiences, the actual doing of it, than they were from all that time spent in the classroom. There was even a quote from one of the students in the study, and it really stuck with me. They said, "I wish we had more preparation before being thrown into a clinical setting."
Which makes sense. It's one thing to grasp the overall concept of IR. Like, yeah, checking in on patients is good. But to actually put that into practice in a fast-paced environment like a hospital, dealing with real patients who have complex needs, that's a whole other ballgame.
Oh, for sure. And we can't forget, this isn't just about some theoretical knowledge, right? This is about patient safety, which is paramount. It's everything in nursing.
So you're talking about some real potential for discomfort, maybe even some anxiety for these students, right? Being thrown into the situation where they don't feel totally prepared.
Absolutely. And that's understandable, right? It's a high-pressure environment, after all.
For sure. But even with all that, the study still found some pretty big benefits to kind of being thrown in the deep end with IR, right?
Oh, definitely. Because that hands-on experience, even with the challenges, it's invaluable. They picked up so much so quickly. In fact, they actually reported a huge improvement in things like communication skills, time management, all those core competencies you need as a nurse.
There really is nothing quite like learning by doing, is there?
Exactly. And it went even deeper than just those practical skills, too. The study found that participating in IR, even as students who were still learning, it actually boosted their confidence levels.
Because they weren't just observing, right? They were actively taking part in patient care, playing a real role even while they were still learning the ropes.
Yes, it gave them ownership, a sense of being a vital part of the care team, and the study showed just how much that resonated with them. And this wasn't just some internal benefit for the students either. It actually translated into more effective care for the patients as well.
Really, so we're saying the patients themselves actually felt the positive effects of these students doing their IR rounds.
Yeah.
What did that look like, practically speaking?
It was all about those regular check-ins, those touch points. Because of the rounding, the students saw an increase in things like patient trust. Just from those interactions, that feeling of being listened to, really heard.
It's about forging that genuine connection, right?
Yeah.
Showing the patient that they're more than just a name on a chart or a bed number.
And that's why I think the student perspective is so insightful. They were seeing firsthand how those seemingly small interactions, just taking a few extra minutes to really listen to a patient's concerns, it had a real impact. There's even a quote in the study. One of the students said they noticed patients seemed more at ease, less anxious, knowing that someone would be checking in on them regularly. It provided reassurance having that consistent presence.
It makes sense. When you're in a hospital, things can feel so uncertain, even a little scary. Knowing someone is looking out for you, checking in regularly, that can make a world of difference.
Oh, absolutely. But, and I think it's important to acknowledge this, no system is perfect. So were there downsides to IR? Challenges that the study found, of
There's
course.
always room for improvement, right? In any field, really.
Exactly. And one thing that came up a lot was inconsistency in how IR was implemented. Basically, experienced nurses often had slightly different approaches, different ways of doing things, which understandably left some of the students feeling a bit confused, unsure of the right way to do it.
Oh, like having different teachers with different teaching styles, right?
Mhm.
That can get confusing when you're trying to learn something new.
Yes, a perfect analogy. And of course, we can't ignore the elephant in the room. Staffing shortages, I mean, that's a whole other challenge in itself, right?
Challenge that unfortunately impacts so much of healthcare, yeah.
Exactly. And it made it that much harder for nurses to implement IR consistently, even when they knew how valuable it was.
Trying to provide the best possible care with limited time and resources is incredibly tough. Which I guess leads us to the next big question. Knowing these challenges, knowing the obstacles, what can we do about it? Did this study have any suggestions for how to improve things?
They did. And a big one that they emphasized was the need for a more standardized approach, specifically better integration of IR into the nursing curriculum, like right from the start.
So instead of just tossing them into the deep end during clinicals, we equip those future nurses with the tools they need, build that confidence early on so they can actually implement IR effectively right from day one.
Right, exactly. Make it second nature. And the researchers, they actually suggested incorporating like way more hands-on training, maybe even some simulations, build that into the curriculum itself. That way students could start developing those skills in a more controlled setting, before they're face-to-face with all the complexities of real patients.
It's like having, I don't know, a flight simulator, but for nurses. Get those reps in somewhere safe before they're the ones responsible for a plane full of passengers.
Exactly. And it really just goes to show how crucial that kind of preparation can be, especially in healthcare where the stakes are already so high. The study also really zeroed in on another area that needs some work too, and that's communication.
Between, you mean like the experienced nurses, the ones actually doing the rounding, and the educators, the ones developing the curriculum?
Yeah. Yep. Exactly that. Bridging that gap, getting everyone on the same page. Because if the people on the front lines of patient care and the people shaping how new nurses are trained, if they're talking more, working together more closely, well, that's how you create a more unified, more consistent approach to IR.
It's about making sure everyone's singing from the same song sheet,
Mm.
right? And that those future nurses feel supported, prepared, not so lost in the shuffle.
100%.
Which really brings us back to what this whole deep dive has been about, right? We
Mm.
didn't just want to define intentional rounding. We wanted to really dig into it, explore all the little nuances, those everyday challenges, the unexpected rewards, and we got to do it all through the lens of these pre-registration nursing students, the ones just starting their journeys.
And I think by doing that, we've stumbled upon some pretty interesting questions too, because this study, it focused on those brand new nurses, right? But you can't help but wonder, how does all of this perception of IR, how it's implemented, how does that change as a nurse gains more experience?
Yeah, do those initial anxieties, that feeling of being thrown in the deep end, does that fade away, get replaced by confidence? Or do completely new challenges pop up as they move through their careers, encounter different types of patients, different healthcare settings? So many possibilities.
And just what if the very nature of rounding itself, what if that transforms too? What starts as following this strict protocol, a checklist, maybe over time it evolves into something, well, more intuitive, almost like an instinct, a sixth sense for what each unique patient needs in that moment.
Kind of like, what's the difference between a brand new cook, right, who's carefully following every single step in a recipe versus like a seasoned chef who just knows, instinct, years of experience, a little bit of magic, all rolled into one.
Nailed it. It's that perfect blend of knowledge, experience, instinct. That's what transforms a profession into an art form. It's pretty cool when you think about it that way.
It really is.
Yeah.
And it's something for all of us to think about, really. Whether we're future healthcare workers, whether we're seasoned professionals, or even if we're just someone who enjoys these kinds of conversations, these deep dives into the ever-changing world of patient care, it's fascinating stuff.
There's always something new to learn.
Always. We might have reached the surface on this deep dive, but this is something that really keeps going.
Hmm.
It makes you stop and think. How would your own experiences, your observations, whether you've been a patient yourself, a family member, even a healthcare provider, how would all of that add to this conversation about intentional rounding? Because even in this practice that seems so simple on the surface, there's actually this incredible depth, all these evolving perspectives, each one shaped by the individual journey of that healthcare provider.
It's a conversation worth having, that's for sure.
100%. Until next time, everyone, keep asking those questions
Yeah.
and stay curious.